Welcome to Planetary Health First, Mars Next. It is going to be an amazing journey today. Hope you are ready for liftoff. We are live now. Welcome. Well, this is awesome. Welcome to Planetary Health First, Mars Next. I'm Michael Mann, the host. We have an amazing guest today, Vandna, and I am so excited we got you here. I know we've been trying to work out our schedule and our calendaring. Can you give us a little bit about you and your background, Vandna?
Yeah, sure. Thank you for having me, Michael. I know it has been a little bit of a scheduling challenge. I currently work with the AmeriHealth Caritas family of companies based out of Philadelphia, and I lead the quality performance reporting and Medicaid risk adjustment teams. My background is quite varied. I have a strong and deep experience in HEDIS and quality improvement, having worked for several large health systems or health plans. I also have worked for a few vendors in the consulting space, and I'm also a former HEDIS auditor. So I kind of feel like I've had the benefit of seeing health plan operations or experiencing and influencing health plan operations from a number of different seats, so to speak, at the table.
Cool. I love that you've had that perspective from, different perspectives. So we're going to kind of drive conversation today on performance improvement initiatives and provider collaboration. I know that's a big area, a big topic. Do you want to sort of start us at ground zero, what that is, sort of so we can unpack that?
Sure. Every health plan the goal of a health plan, right, is to provide services to our members and to provide services that are of high quality of care and service. In order to do that, we have two significant areas of focus. One is our collaborative partnership with our providers and how we engage in that partnership to ensure that they have the information and that they need to be successful from us, as well as the shared responsibility of addressing our members and patients' needs as it relates to services. And nowadays, it's a really big topic of ensuring that we have information on how best to do provide any wraparound or services as it relates to health inequities and disparities. In that light, we spend, as a health plan, there's also a significant focus on understanding how we're performing through the use of data and being able to provide or establish different initiatives to improve on that performance.
So if there's a data, what is the most important data that could help plans be better to their members or support the providers? Like, I know we use HEDIS as a big thing, but if there was 1 to 3 metrics, and maybe that's too little, but what would be those metrics that you think would really drive where we need or where you see care needing to be?
I think it's less about a metric because most metrics are very focused or targeted on an event or a service. So we might be looking at, a breast cancer screening for our women in their 40s and 50s. That's very targeted as to whether or not you're getting it. I think the most important thing in this process, as we think about improving performance, is more of the foundational data. What's the data? What do we have in terms of the members' experience in the system to be able to continue to support them effectively as they continue on their health journey? So that includes, really, it includes an accurate phone number. It includes, information on what they're struggling with, if they're experiencing food insecurity, if they're experiencing housing insecurity. Those are opportunities for us as the provider system, as well as the health plan payers, to collaborate and identify either community-based organizations that might be helpful or other ways in which we might support our members to find the access to those services that can then help to bolster their overall health journey.
I like that you just talked about a phone number, and that's like the ground of truth. You can't connect if you don't have a phone number, and that's not a small thing. That's a
Mhm.
big thing, and those change a lot when you're dealing with at-risk members through the phone. So, are you when you talked about that, you made me think about the vendors that are supporting these things. How does that work? You know, running a health plan, doing what you're doing. How do you overlap those organizations that can really support that? I mean, you alone can't do that. Tell me
Right.
about that.
Yeah, there's in many in our world, in the payer world, we spend a lot of time identifying and collaborating with community-based organizations, especially in the Medicaid space, which is where we are heavily focused for vulnerable populations. And so that interaction and the interface with those community-based organizations helps to somewhat alleviate when we don't have a phone number. But it's less about a vendor to me. I believe very strongly that this is a partnership where the ultimate goal is to ensure that the members that we serve as payers, and this I think is for any payer, is that they're receiving the appropriate the opportunity to receive the care that they need. And so bringing in partners, whether it's data partners to help support that, finding that phone number or contacting the member, or community-based organizations that can help to fill in gaps, whether that are related to food, housing, social needs. Those are the opportunities where I see we have the most kind of the greatest path forward.
What would you like to see happen in 2024 from
Mhm.
a big point of view, whether it be policy or technology, to make these things better?
I'm a firm believer in a couple of things. One, we in as healthcare leaders in this ecosystem have created a very complicated experience for our patients, our members. I believe really strongly in simplicity, and I think ultimately, if I were to look at policymakers, I would ask for some grace and simplicity. There's a significant amount of complexity, whether we're talking about federal policy or state policy, and at some point, that the interaction and the intersection of the competing policy environments really creates complexity for patients as well as for payers and providers who ultimately, are the primary point of contact. So I would ask for simplicity. I think the next thing is if you have simplicity, then you really want to be able to have an ecosystem where we can find an appropriate and correct, accurate way of sharing data to truly support the care journey. And if we were to be able to create a system that could establish those two, even just somewhat in a better situation than where we are, I think we could leaps and strides make some improvements in how because we all are experiencing it, right?
Mhm,
How
mhm.
we experience this system.
Vonda, I really like what you said about the care journey. The care journey. Like, what is that care journey? And I think that would be a great area to unpack because I imagine you have the acute, you
Mhm.
have the pharmacy, you have all these different spots of where you are in the journey. You have the inpatient, the encounter, and all these are requiring different things from different stakeholders. That could be a whole series in
Mhm.
itself. So, is there anywhere where you'd like to start today with that care journey and what that's looking like today and how we could maybe make that better?
Yeah, the journey of care is very individual for each person. I can't define what that journey is, but I can actually identify through data and through clinical best practice how we might engage and support that journey. That journey is requires the patient's it requires the patient's engagement. Definitely, there's a significant um, reliance on the providers of care, and so that care team. and being able to support that going forward. I would say in order to, I'm a data girl, so I hate to always come back because I know people get frustrated, but I come back to the data. The better your data is, the more, and the better and more accurate your data is, and if it's free flowing. So the word interoperability hasn't come up in this conversation yet, but as we think about what CMS is looking for, what the National Quality Committee for Quality Assurance, NCQA, what states are asking for is the establishment of an interoperable system of channels for sharing data. That interoperability and that system of data exchange has a profound, or can have a profound effect on impacting every member's care journey, because we all have nowadays, most of us have, we have an app on our phone that allows us to see, the notes and information from our provider visits. You have, there's a number of different versions. Many of the EMR systems have their own, or tap into one. That care journey is really driven as we continue to work to move into a highly technology based experience, just and outside of healthcare as well, is using technology to not have to go into multiple apps, not have to be able to take there was a day when our parents used to have to take file folders with printouts of their records, right? Everything was on paper, or you had to have a copy of a CD of an imaging that you had. A lot of that now is in the technology, it's on the app, but it's still not connected. So how do we support each other in our experience in healthcare on their care journey? It's through information. It's through accessible information that really provides and opens up transparency and conversation.
I was having a conversation with someone the other day that was on my podcast, doctor, and they were talking about how they might see AI really possibly helping this interoperability. Have you heard of any companies or any excitement about any technologies that might be helping these flows of data or interoperability challenges?
There's a lot of talk, and there's a number of organizations that are really looking to support that. I would say there's been different areas in which AI or machine learning can help support processing of like prior authorizations. That's a pretty common one that I've seen. There's a lot of support for using AI to help support care management and member contact centers, because that helps. It takes away the reading of a script to really making and engaging in a conversation with a patient. I think that's an incredible one. I've seen AI used in some clinical aspects for provider systems where they can then get the benefit of this wealth of data to help support their clinical decision making. It's going to be an incredible future for us as we continue to see how AI is applied within our system. In terms of interoperability, the challenge is because we still have infrastructure and we still have walls around our data. And so we need to find a way to kind of work through not breaking the walls down, but helping to open up some doors to allow the data to flow.
So tell me more about these walls. What are these walls? I know, there's different organizations that wall it off, but what are these walls from your perspective, and how can we better open that up?
One of the biggest questions that we continue to face in this organization is in this system is who owns the data. If I go to a provider, some providers believe that because the data is in their EHR, it's their data. Ultimately the question becomes: is it my data? Is it the member or the patient's data? Who owns the data? And that is an unanswered question that creates these walls. And so every system has a wall. Some provider systems are are progressive and open and share data more readily. I'm really excited about as we think about health insurance exchanges, those are opportunities to really be able to create the channels for data flow amongst providers and with payers, and be able to, I've seen HIEs that are focusing in on SDOH and social needs, and how are they collecting data, even now integration of these community-based organizations. So the momentum is there. It's starting. It's just a question of really getting beyond the control of the data and really being able to ensure we always have to protect it. We don't ever, and so it's the fear of experiencing kind of an exposure versus really using the data to help support the clinical progress or opportunity.
Yeah, sadly, we keep on hearing, what was it, 23andMe? Like, I mean, we really do have to do everything we can to safeguard trust, privacy, hacking, 6 million
Yeah.
records or people's information. But I really liked how you talked about the walls, but then it's the data, like who owns the data. And then I look at and think of my own record when I've seen it. It's like, that is not me. So I think going back to our earlier conversation about provider collaboration, is that with the patient and the family and the on that journey of getting the right data. So it seems like just the collaboration and getting the note right. But it seems like there's a challenge from a provider with getting paid. So it seems like then there's I guess whatever providers or doctors will tell you, there's a whole nother story, where an encounter then becomes something else. So, they have to get paid. But anyway, it seems like there could be on that conversation a lot of opportunity with the social determinants of health when you really understand a person, with a person's really involved in it and they own their data. Tell us from a payer point of view where you're excited about those social determinants of health, getting that right information and moving that to better outcomes.
Yeah, I think one of the areas where social needs social needs screening and understanding is within the behavioral health space. We talk as I think as a society about mental health concerns and being able to understand how best to support our friends and neighbors through these different challenges. Mental health and behavioral health, especially from a payer standpoint, it is a very difficult challenge and hill to climb, because many of our folks, society wise, it's just no one wants to really come forward and admit. So we are getting over some of that hurdle. Being able to understand and have the ability to contact and stay in touch with our members, so that the social needs journey for behavioral health, being able to, I think there's many community organizations that really are the eyes, ears, and arms for payers and providers, because they're out in the field. They're out kind of engaging with folks that are the most vulnerable. Whether someone that's experiencing homelessness, someone that's experiencing extreme, kind of an acute situation, and having the ability, we've engaged with different organizations that have, kind of a 24/7 opportunity to contact them. So there's always someone at the other end of the phone, whether you're calling or texting, someone that can help you talk through a situation that then can help to deflate any of the potential consequences.
Seems like we're in a new period with social determinants of health, redefining what health is.
Mhm. I would say so. Health in today's world is multifaceted. It's heavily defined by, who you are, where you live, what you know, what you have available to you. And it's also defined by what you want to do. It's
Mhm.
ultimately, um, you know, uh, I have the right to kind of take my health journey the way in the direction I want, and that sometimes is in conflict with what my family members might want or other folks might want for me.
You do a lot on health equity.
Mhm.
T- Tell what is health equity?
We spend a lot of time talking about what's equitable in health, and it's a question of access. It's a question of education. It's about essentially ensuring that everyone has access or has the opportunity to access health care in their that meets their needs. It's not a one size fits all. It's not having a doc in the box down the street and being able to get there. There's women that have another child, and so they need someone to stay with their children in order to go to the doctor to see a doctor themselves. It's ensuring that there's the support to be able to continue on your journey. I used to say when my kids were little, I used to tell my pediatrician all the time, it would be so nice if you would have an internist or a doctor that I could see while I'm here. Because when you've got sick kids as a mom, the last thing you're really thinking about is trying to take care of yourself and keeping yourself from getting the flu.
Mhm.
But those are challenges that we all face. It's just that many of us don't have the support services to be able to find the balance. And health equity is using data and information that we have to help support um, the possibility of finding or the probability of finding a balance.
And where are we on this journey with health equity? It seems like we just recently, sort of around the same time as social determinants of health, kind of created this, um, at least defined it, brought the awareness up. Where are we on improving, realizing it? What would you think?
I think we're pretty early stage.
Do you think if we realize health equity, are we also going to see like the whole concept of health no longer need the term mental or behavioral health? Will there, I mean, if you realize health equity, do you think we're not going to have these, I mean, is it going to be just well-being? I mean, just realizing your well-being functioning at the highest level? I mean, is that the end goal, that there will not be a separation of physical or mental health?
Um, I think it. I think that I think in a visionary standpoint, maybe today health equity is so granular and is so driven by the societal kind of the social aspects of where you live, who you are, what race you are, what gender you are, what you have available to you, that it just can't even see how we could begin to blend mental and behavioral health together. If I were to have a vision, I think it would be wonderful to see any clinic have both a mental and a behavioral health aspect or component to it to be able to support um, everyone through that journey because we all know, I mean, there's numerous apps nowadays, right? Like you have Calm, you have whatnot. If you can take care of your mental health, if you can take care of and find the peace within yourself, you can also start to find some healthy behaviors. You can find and create a healthy experience for yourself. Not saying that that's doable and it's something that's that easy, but there's steps that are available. But it's not the way that our system works today.
Mhm.
I have heard of different programs where um, in especially for pediatricians or for pediatric offices, where an office is inclusive of a social worker to help support a child's needs and the parents' needs, understanding what they may need to continue to support their children's growth. And I think that's a great opportunity for us as we think about that journey.
Yeah, I love how you articulated it so holistically, and so well spoken. My thought was, we currently have sick care. We have a real 98% fee for service. I know, and on the payer side, you're doing everything you can to move away from that, right? For multiple reasons. But it seems like currently it's, our healthcare system, how and I think what you're doing is moving us there with all the different, data, the metric. What I know, I said metrics earlier, probably isn't the right term, but it seems like so many things can make one not, on an individual level, flourish or be at the highest level, and so with whatever it to me seems that, I would love to see us, being in sooner than later with treatment, whether it be personalized health. It's like, how can you separate if your hormones aren't right,
Mhm.
your chemicals aren't right, your health isn't right? It just seems like we need to accelerate supporting people physically, um, outside of that 170 whatever days out of the clinic. And I feel like, sadly enough, the model that health plans actually are in the best, health plans and employers are more unified to do that than the provider, unless, anyway, I'm talking too much. My wife says stop talking, so I'll stop at
No,
that.
I love what you're saying. I think it comes down to respect. Healthcare should be driven on it by a model of respect.
Hmm.
And that's that what the dependencies are, unfortunately, are time and money, right? So it's if we have respect in the system for a patient, that comes to the office, you know, like an elderly patient that comes to the office, and really they might talk a little slower, they may talk a little more roundabout, and it's about having the respect to be able to give them the ear, to listen to them, because that is part of that mental behavioral health connectivity, and being able to understand what their needs are, what they want to see for their health journey as it continues, right? And so it's about respect, and then being able to backfill in or back into how do we achieve that, and how do we ensure that people have that sense of respect, whether it's addressing health equity or it's addressing um, clinical best practice, um, addressing access.
I feel like today you've bubbled up a question, Vonda, on this great discussion with health equity, with performance improvement initiatives, and provider collaboration. Is we don't even know the question to ask often. It's like the Hitchhiker's Galaxy, like the answer to the universe is 42. I mean, I just feel like we're still like this humility in healthcare. We have a lot of data there, but when it comes to really moving each and every, the fact that people know their loved ones and they still succumb to suicide. I mean, there's certain things that are so out there that are beyond our knowing, and I'll stop at that.
Yeah, I just wonder if it's just one question, right? It's a series of questions. And maybe it's not about the question. Maybe it's about the listening.
So the listening. So I think what I've taken away from this is the empathizing. The empathy is the actual willingness to be present, to listen. And so that's the takeaway today, is
Mhm.
that I got from you. Is
Yeah,
that correct?
I spend my day seeking to understand, right? And so I believe in a very data driven model, but much of my day is really about seek to understand.
And so when you go about that with the data, tell me your process. It sounds like you're a detective. Tell me how you're using those, parsing that without anything proprietary. We're gonna.
I appreciate that. It's really, I lead a measure-driven, a data-driven team that is really focused on those metrics, right? So one is using data and tracking and trending, being able to create analytic models with the data that you have. Some of that is the machine learning AI that we were talking about earlier. Is if I've seen the trend of my data, historically, kind of on an increasing slope, am I continuing to see that? How do I create a glide path or an understanding of where I might be going? How do I impact it? Can I see and understand where there's dips and ups and downs in the data that I can then go back and see what might have changed? Is it just a data gap? Is there something that impacted, why we're seeing that? It is that a kind of investigative process, and it takes a number of folks to really be able to dig in and ask questions. Um, Data is an incredible asset when you ask the questions. I think, as you were saying earlier to me, it's being inquisitive. If you're just going to take the data and really, take data and then and create a table or a dashboard and just drop it out like that and say this is what it is, you're not creating an insight. What data teams today are really focused on is creating insights. And it's about, nowadays we're stratifying on different social needs or
Mhm.
race, language, ethnicity. So if I'm looking at a specific metric, am I seeing that there's a particular race or geography, a zip code that is experiencing a significant delta in terms of activity? So we have that capability now, and that's where the fun happens, so to speak.
Cool. I liked how you sort of described your detective data dance with your team on that pursuit, but you didn't give any of the proprietary special sauce. I'm hearing the machine behind there, that the sort of stuff, the algorithms, probably some patents there pending or whatever. That's really super cool. Where are you going in 2024? You have any conferences? Where's like this year, some things that you will find that would really help you on your pursuit of being a better healthcare leader?
There's a number of conferences that typically, like many healthcare leaders go to. I know there's HIMSS, and health was a big one this past year. I've really enjoyed Chime. I've attended that previously. I did not attend this year, but I may get back there this year. I know there's a number of RISE conferences. I was actually at several this past year in 23 as a speaker, and so I think there's a great community in the rise space as well, in terms of the opportunity to connect with your peers and really learn and share and collaborate. Uh, I feel strongly that there's many ways to connect with each other, and so I'm not always the greatest networker, because time is very valuable.
Yeah.
But I have I'm very lucky to have a strong network that I can rely on, both internally within the organization as well as externally.
Is there anything that you find that charges you when you're not in your day to day? Anything that you feel that really helps you be a better leader?
I think it would be my family. I think kids help keep us grounded.
Mhm.
They help. It's always nice to have people that can say that doesn't make sense, because that's not always the way that we interact with each other in a professional, kind of corporate world. Um, I take a lot of my lessons from my kids. As you said earlier, you're inquisitive. It's about being a leader in a large corporate environment, and I think it really is, it does not matter the size of your organization, is about listening and learning. And I feel very strongly that it's about collaboration. I struggle with cultures that allow bad behavior, and
Mhm.
I struggle with cultures that are really built on competitiveness instead of collaboration. Because I don't work in the healthcare space because I wanted to sit in an office and be in front of a computer all day. I believe in healthcare and what it can provide and what the opportunities are for anyone. And I want to see those opportunities and the folks that we support kind of flourish in their journey. And I also believe very strongly that healthcare is not a one-man band.
Mhm.
In order for this to work well, we have to have all the sections of the orchestra or of the band, and they have to be playing in concert.
Well, Vonda, I really appreciate you coming and joining today.
Thank you. Thank you for having me. I appreciate it, and I apologize for the scheduling challenges that we've had.
No, no need. Is there anything I don't want to have missed? I'm very fortunate to have you here. All the experience and knowledge you have with data analytics and really moving that knowledge. Is there anything that you want to share with as we speak today together?
I would say that, for those folks that are coming into the space, continue to seek to ask questions and clarify. There's a lot of experience, and there's so much great opportunity with technology, with AI. I believe that there's a great opportunity to balance experience and knowledge with technology, and I look forward to seeing what we as an ecosystem can do and accomplish.
Cool. Well, that is when you think about AI and all the it is we're just it's not even I guess there was some Gemini or something that was just released yesterday, the Google's version.
Mhm.
So we're just I guess 1% of 1% with
Mhm.
AI coming through. So yeah, it's going to be big. Is there anything else that you would like to share on provider collaboration, performance initiatives that we've left off?
I would love to see 2024 be the year where that we remove the fax machine from healthcare.
I love that. I love that. So let's leave it at that.
Yeah.
This is the year 2024. You heard it first on Planetary Health First. We are going to see the year 2024. No more fax machines, right?
That would
In
be
healthcare.
lovely. That
That's
would be
awesome.
lovely.
Well, I really appreciate you stopping by, and it's been awesome. And so we're going to call it a day.
Thank you so much.
Friends, it has been a great journey today on Planetary Health First, Mars Next. Follow us for more on Planetary Health First, Mars Next. Until next time, peace be with you.